Today, um, I'm Dr. Moshe, one of the cardiologists. I will discuss some of the questions that one of the TV journalists asked me. So those are the questions that I'm going to uh, discuss that again. So they asked me one question, what is your cardiac concern and what type of cardiologist do you need? My biggest cardiac concern is that people have heart disease, that they are not aware of it. People can easily ignore chest pain with gastritis or shortness of breath with fatigue instead of congestive heart failure or heart-related blockage. They can even confuse their palpitation with anxiety. So you need to be seen by a cardiologist depending on what type of symptoms you have, as we have intervention cardiologists or electrophysiologists or heart failure cardiologists in addition to general cardiologists. The second question they ask, what are the treatment options and risk and benefits of each option? So treatment option depend on whether or not there is a blockage in the cardiac vessel, which can be freed by percutaneous intervention, electrical abnormality by pacemaker, structural abnormality by AICD or CRT or LVAD, left ventricular assist device. So those or triple basal disease can be managed by CABG or arrhythmia by ablation or radiofrequency. Or left atrial appendage by clot. Left atrial appendage clot by Westman device or different anticoagulants. We treat with lots of diagnosis with different medication, including anticoagulant means blood thinner. So risk depends on what disease it is and how we treat it and how invasive the procedure is. Third question is, how will you monitor my heart condition? So I can monitor heart condition by EKG, Holter monitor, loop recorder if I suspect arrhythmia-related issues. And later, I can place a pacemaker or AICD or LVAD as well as CRT device to monitor arrhythmia or structural heart disease. I can place a stent on the blockage to see whether or not patient is chest pain free. I can have the blood test if there is a risk of having heart disease in the near future, and I can manage lots of heart disease with different medication. Number 4 question, they asked me, what lifestyle modification should I make to improve my heart health? Well, a lifestyle is a good way to improve your heart health, to get heart healthy diet, stay away from processed foods, get plenty of fluids, get enough exercise, sleep, and stress-free, and have a good protein and fat with good oils like olive oil is good. For a stable heart condition, at least every 3 months is a good way to check your heart. For pacemaker or other intervention, after 1 month, then every 3 to 6 months intervention is good enough. Make sure there is no issues. Then they asked me, how often should I follow up with you? Again, for somebody is heart healthy, then every 3 to 6 months is good enough. Will any changes in my lifestyle make a difference? There was another question. Of course, lifestyle will make a huge difference in your heart health, as long as it is not aging process, as long as it is not genetic component to it, because we know that we cannot change age or genetic process. But however, if we stay away from bad habits, like smoking, drinking alcohol, if you have a good lifestyle modification with exercise, if you have a good diet modification with fruits and vegetables, stress-free, smoking or drinking away from that, enough, good sleep, hydration, these are all good to keep your heart healthy. And then there was another question they asked, why should you prescribe a certain medication and what are the benefits? Again, every medication improve heart health differently. We need to know whether we are treating hypertension, cholesterol, or heart failure, arrhythmia, hypertrophy, blood clots in the chamber of the heart. So again, every medication plays a role differently, and overall the benefits that we need to make sure the patient is symptom-free, make sure we need to see that patient will have a good lifestyle at near future. So another question they asked me, what is someone's risk of having a cardiovascular problem now or in the future? Well, someone's risk of having cardiac event depends on the family history, depends on what type of lifestyle they are having, whether or not they are treating their chronic condition like hypertension, blood pressure, cholesterol, all these things they are managing that pretty well with their medicine, with their diet, lifestyle modification or not. So those are key factor in terms of having cardiovascular problem now or in the future. So another question they asked me, what are the symptoms that might indicate a worsening problem or the condition? Well, it depends on the symptom. Let's say you have a chest pain and you used to, do all the activity, you used to walk many blocks. Now you cannot do anymore walk because you get short of breath, you get now leg pain, leg sweating, and you have chest pain if you do any activity like shoveling snow or walking up stairs. So those are very concerning, and you have to address that issue to your provider, especially cardiologist. So then another question they asked me, what testing is required and why do I need it? Testing is dependent on what type of symptom patient came with. Is patient complaining about the high blood pressure? Is patient complaining about the cholesterol? Then you can do different blood tests. If the patient is complaining of chest pain, then you can do some of the different type of stress test. We have exercise stress test, we have stress echo, we have nuclear stress test, we have diaphragmal test, all kinds of things. Again, it depends on what am I concerned about. If patient, having a very about high probability of having chest pain with a blockage or something, then I can do CT cardiac angiogram, cardiac PET scan, angiogram, all these things. If patient complaining of the arrhythmia, then you can go with Holter monitor. If patient has a cryptogenic stroke, then you can go with loop recorder. If we don't find anything, in addition to echocardiogram, make sure PFO or any of the chamber has no little hole in it. Again, it depends. What am I treating for? What's the patient is complaining for? Then we can have different type of test. So they asked me lots of other question also. I don't remember it right now. So this is the thing that I talk about today. Hopefully you will see this video, and if it's not, then at least you have some idea that what a cardiologist does for you to have a healthy diet. At last, I will tell you that you have one heart, one life, so take good care of your heart. Thank you.